A number of features and functionality exist in the new application which optimize usability. Users are now able to concurrently collaborate on the same note. See a list of users who are currently contributing by clicking the Users Editing button on the upper right-hand corner. Fields log if another clinician is updating them. This prevents accidental overwriting of information. When another user has edited part of the discharge summary, there is a notification. This will automatically disappear after a few minutes, or can be closed by clicking the X in the right-hand corner. Either prescriber or a pharmacist can sign off or cancel sign off on a medication subtab. If another user is working on the same note or within the same medication subtab, all users will receive a notification to coordinate sign-off to prevent the loss of any work. Once sign-off is complete, the sign-off status will be updated and tracked.
Additional functionality in the application includes hovering over headings to indicate the definition or functionality provided. A number of hyperlinks to important information or supplementary forms are also available within the application. These include LU codes, EAP requests, samples of good discharge summaries, and the provider list add, change, deactivate form. Another benefit of the new application are buttons to pull data into fields repeated from previous subtabs. For example, drug plan coverage and pharmacist or prescriber information.
Type-ahead cells throughout the application provide similar options that narrow down as more information is entered. This optimizes data entry and ensures consistent terminology. Options provided are the most commonly used terms at UHN. If a discharge date and discharge diagnosis are both selected, the patient's length of stay is compared to the average length of stay for the specified diagnosis. If the patient's length of stay exceeds the average, this reminder will appear, prompting users to double-check the diagnosis entered. Drop-down options with a flag or star icon indicate the option is a flagged intervention and/or potentially contributes to a quality-based procedure.
In the event that there is no information to be documented in a particular section, the No Relevant Information to Note checkbox can be selected to indicate the same. The section will no longer appear in the final note. Under the Comorbidities, History, and Risk section of the Diagnosis tab, for each condition entered, the appropriate radio button can be selected to indicate pre-existing or developed status. The appropriate button can also be selected to indicate whether the condition impacts the length of stay. The discharge summary note is populated accordingly. Information in the Comorbidities, History, and Risk section of the Diagnosis tab can be pre-populated from a previous patient visit using the highlighted button on your screen. This information can then be edited if needed by clicking the appropriate cell.
Within the Coursewell and Hospital tab, under the Investigations section, lab, radiology, microbiology, and other results can be filtered by type by clicking on the appropriate rectangular button above each respective table. Radiology reports and OR notes completed during the visit can be previewed within the application. Click the View Report button to view the report. Copy and paste pertinent information into the appropriate cell within the Details section. Edit the information as needed to ensure the note is succinct. Future appointments for the patient scheduled in the Pathways Healthcare Scheduling System can be pulled and added to the Appointments and Referrals list by clicking the Update from PHS button and making the appropriate selections.
Tables have also been enhanced in the new application. You will notice the following features of tables throughout the application.
Clicking on the blue Update from EPR buttons will pull the most recent information documented in EPR into the table being edited and overwrite the current data in the table. These buttons can be used to update allergies, primary care and most responsible provider information, lab and radiology results, and medications.
Clicking on the Realign BPMH Medications button pulls signed off BPMH medications into the table being edited and adds to data in the table. Clicking on a blue Add button adds an additional row to a table in order to enter additional information such as medications, lab and radiology results, interventions, comorbidities, complaints or concerns, summary details, and appointments.
Clicking on a blue Clear Table button will delete all existing information in a table after the action has been confirmed.
Dotted edges along the side of a cell indicate that the row can be moved up or down. A garbage can icon on the left side of a row can be clicked to delete the row.
A lock icon on the left side of the row indicates that the row cannot be deleted. A grayed out cell indicates that a value cannot be entered or edited.
Clicking on the Add Column button adds an additional column to the medication grid.